So other than the barium sulfate contrast media, we also have the iodinated or the iodine-based contrast material, both ionic and non-ionic contrast material. So because this material is most commonly introduced towards the venous system of the patient, sometimes it will produce systemic reaction. Okay, so many patients are sensitive in varying degrees to iodine compounds. Compared with barium sulfate, since moagi naman gid siya sa imuhang intestinal tract, it will not be absorbed by the body. Mutong dili kay siya paka-affect sa internal system nato sa patient. And then kani the iodine, since it is injected directly into the venous system, so it will go towards all of the parts of our bodies. If ever na mga sensitive nga areas to iodine, so it will cause a reaction. So local reaction includes at the site of the administration. Since inject mo itong contrast material dito, pag mag-inject na ganang contrast material, sometimes the patient will feel pain, burning sensation dito sa injected nga site, itching, and then sometimes numbness. Okay, so responsibility of the rad tech is number 1. If ever na ay extravasation or the contrast material has extravasated into the surrounding structure of the vessel, you have to provide a warm towel. Okay, that is to dilate the blood vessel and allow the contrast media to be absorbed by the blood system or the blood vessels. And then number 2 is to document patient reaction. So the reactions of the patient can be categorized to mild, moderate, or severe systemic reactions. Okay, examples of the mild systemic reactions, we have nausea and vomiting, hives or the urticaria, itching, sneezing, na ay vagovagal response, or the patient may feel fear, weakness, dizziness, sweating, and feeling of passing out. So if these reactions are noted by the rad tech, so these are the rad tech responsibilities. Number 1, monitor and comfort the patient, and then number 2, document patient reaction. So that's one of our very important na role as rad tech, diba? We have to document the patient's reaction. Yun, bahala pag mild pa na siya, bahala nangatol na siya gamay, or nalipong baka siya, you have to record the reaction of the patient. Okay, and then of course you have to talk to the patient always. Along the procedure, you always have to talk to the patient. Ma'am, what are you feeling? Now, how are you feeling right now? In Bisaya pa, ma'am, kamusta imong gibati? Diba? Nalipong baka, kasukaon baka, nabay na nga to si imuha, okay ra ba imong paghinhawa? Wala baka na wala ba naglisod o ginhawa? For example, nakahigda si pasyente, basing naglisod o ginhawa si pasyente while naghigda, so you have to allow the patient to change his or her position. Pwede nimo ipatakilid or pwede nimo siya ipalingkod. Next, we have the moderate systemic reactions. Moderate systemic reactions would require medication. Reaction examples, we have excessive urticaria or hives, tachycardia or the rapid heartbeat, giant hives compared to mild reaction, and excessive vomiting. So of course, because of these reactions, these are your responsibility. You have to call for medical assistance. Okay, since you are a rad tech, there are limitations to what you can do and what you can assist the patient. And since you are in the radiology department, your materials inside of the radiology department may be lacking. Okay, so that's why, as you can observe, the radiology department is always near the emergency room, because whenever we introduce contrast material, whenever we do procedures, if ever we need the help of, need the assistance of the nurses, or for example, the radiologist or the emergency doctor, dali ra sila tawagod. And then monitor and comfort the patient, and then most importantly, document the patient's reaction. Okay, and then last, we have the severe systemic reactions. These are life-threatening conditions which require immediate treatment. For example, low na kayo ang blood pressure ni patient, nag-cardiac arrest na or respiratory arrest na si patient, nalipong na si pasyente, nawawala na gid ang consciousness, convulsion, laryngeal edema, that means lisod nagiginhawa si pasyente, cyanosis or the bluish discoloration of the skin, difficulty in breathing, and then profound shock. Okay, so that's why dito pa lang sa mild ni mga reaction, you have to be very careful with your patient. You always have to talk to the patient, you always have to update the patient to what the patient is feeling in order for you to document the response, and then in order for you to know your responsibility to whatever the patient is feeling. Okay, so if mo ato na siya sa mild, as much as possible, you really have to stop the procedure na yun. Okay, and then responsibilities of the patient for the severe reactions: call for immediate medical assistance, remove any physical obstacles that may impede the medical staff, and assist medical staff in treating the patient. Okay. So next we have precautions in the preparations and administration of contrast media. So mainly, the technologist and radiologist always ask the patient whether he has reacted or he has had reacted to the contrast media before. Ask about sensitivity to iodine, seafood, asthma, hay fever, allergic reaction to penicillin, or etc. Okay, so that's why in your patient care, diba, it is very important that we take the history of the patient. So you should be serious in taking the history of the patient, especially when introducing contrast materials to the patient. Okay, what if allergy dahil si patient sa mga iodinated contrast material? For example, sa seafood, diba, it is the most common nga question, are you allergic to seafood? Okay, since seafood contains a lot of iodinated material, so it is also related to the contrast material that we have, that we will be injecting to the patient, which contains a lot of iodine. So if mo react na siya dito sa gamay ra nga iodine dito sa seafood, how much more there is sa imuhang contrast material in which it will be injected directly to the vein or the artery of the patient. Okay, so contraindications, the introduction of the iodinated contrast material if ever na siya active nga asthma, if ever na active nga hay fever si patient, if ever na ay allergy si patient to iodine, and then any other drug sensitivity. Okay, so dapat dili gina sila as much as possible, dili gina sila hatagan og iodinated contrast material. So how to test for the sensitivity of the patient? So for example, your patient denies any allergic reaction to any drug, denies any reaction to any food or iodinated or any substances that contains iodine. Okay? So, ni-deny gid sa patient ato nga mga conditions. So, that means, okay siya, wala gid siya reaction sa iodine. That is according to the patient. So, in order for you to test PUDSAD, if ever mo agree gid sa patient for the examination, you have to carry out a test dose in which you have to inject a 1 cc of the contrast material intravenously. And then, you have to wait for 10 to 15 minutes. So, in the hospital setting, it could be some of the hospital protocols. It could be that the emergency staff, that means nasa emergency room, the emergency staff, the emergency nurse or the doctor will be the one to introduce the 1 cc intravenously towards the patient. Okay, so sila mo yung mag-conduct sa test dose. And then, after 10 to 15 minutes, that's the only time na pwede na dayon mo adto si patient dito sa radiology department. Okay? Or sometimes, na po uban hospital that the radiologist will be the one to administer the test dose. But of course, before, even if it is the radiologist inside the radiology room who will be injecting the contrast material, they will always confer with the emergency department that they will be injecting contrast material to the patient at this hour, at this time, and then how much should be introduced to the patient. Okay, so that is still for the test dose. And then after 15 minutes, then we'll continue. If ever no reaction towards the substance from the patient, then the examination can continue. Okay, so during this time, the 10 to 15 minutes na waiting time, you have to be with your patient. Okay, you have to ask the patient during the waiting time, 10 to 15 minutes. You really have to ask the patient, "Ma'am, are you okay? What are you feeling right now?" In Bisaya, again, di ba? You really have to ask the patient, "Ma'am, kamusta imong gibati? Wala ba ka nalipong? Wala ba nangatol? Wala ba nilisod og ginhawa?" Okay, so you have to be thorough. Bahala pag magbalik-balik kasi imong question as long as you are thorough with your questioning. And of course, it makes the procedure safer. Bahalag balik-balik ang mga questions sa patient so long as you are secured with the patient's reaction. Okay? So sometimes, patients with allergic reaction to iodine could be given a pre-medication. Okay, so for example, naingon si patient nga, "I have an allergy to seafood." But then the doctor recommends to continue with the examination. So what to do? Sometimes the physician would would ask the patient to buy pre-medication. For example, kaning Benadryl. And kaning Benadryl, for example, ipapalit sa patient the night before. And then mga 3 hours or 4 hours before examination, the patient will be asked to take the Benadryl, or at least 2 hours before the examination, the patient would be asked to take the Benadryl. Diba? Same sa inyo ha, you have classmates nga allergic to seafood, and then some of them are actually eating seafood, pero before eating seafood, magpalit na sila tambal, mga antihistamine. Moinom sila sa ilang antihistamine before eating seafood in order to reduce the allergic reaction. So almost the same lang gihapon na siya nga concept, no? The pre-medication the patient is given to them or administered and requested by the requesting physician for them to reduce the possible contrast media reaction. The following rules must be observed when using a contrast media. Okay, so number 1, be sure to sign the consent for the examination, or make sure that the patient have already signed the consent form before the examination. And of course, it's not just making sure that the patient already signed the consent form, but also you have to make sure that the patient understood the consent form and understood the process of the examination. Diba? Again, in your patient care and ethics, this was taught to you nga you really have to explain to the patient the examination. Ikaw gi maghatag sa consent form sa pasyente. You have to explain the procedure. You have to ask the patient if there are any questions related to the examination before having the patient sign the consent form. Number 2, be sure you have the right patient. Ask his name, check ID band if ever inpatient, and check chart for the order. Okay, this is especially for the admitted patient. Okay, so for the outpatient, you have to ask his name and then other indications pudayon for his identity. Okay, what if ang imuhang na-injekan sa test dose is the watcher ni patient? Diba? Of course, sayop na kadaan to. Okay, so you really have to ask the patient nga, or the person right in front of you nga, "Sir, what is your name? What is your purpose dire?" Again, imo na po sa pangutanon sa iyahang gibati. Bahala pa og balik-balik. Again, bahalag balik-balik na kay in this type of examination, contrast examinations, it's not similar to a chest PA examination nga, for example, maghatag ka request, and then maghatag kag request, and then pag bayad nimo sa cashier, diretso na dayon ka sa imong examination. For the contrast examinations requires preparation. That means karon lugar magbayad si pasyente, it could be nga ugma pa siya ma-x-rayhan o ugma pa mabuhat ang examination, or it could be on the next day. Okay? So that's why you have to ask the patient, for example, ikaw nakaatubang, imong kauban nakaatubang karon sa pasyente ni dawat. Imong kauban ang nag-schedule. And then for tomorrow, ikaw na ang duty. Imong nakita sa inyong whiteboard is only the name of the patient, the examination, but you do not know the patient, the face of the patient. So if ever na imabot mangutan nga, sir, unsa oras ang amuang examination, then you have to ask the patient for his or her identity, correct identity. And that's why mubalik na po kasi imuhang history taking, you have to ask unsay gibati sa pasyente. Kay base nun niya dili tumaw nga pasyente ang imuhang gi-interview. Or kung dili baka katong example ganina, ang watcher sa pasyente ang imuhang na interview. Number 3, be sure you have the right contrast medium at the right amount. Okay, so of course about the right contrast medium, dapat katug yung iodinated nga contrast material. It could be ionic or non-ionic, depends on the protocol sa inyong hospital. And then the right amount pud sad. So the patient cannot be overdosed with contrast material. Okay, again, diba, these are allergens. This will cause allergic reaction to the patient. So if daghan kay kag mahatag sa pasyente, bahalag wala siya allergy sa iodinated content ng mga materials, it's possible nga naa siya allergic reaction pud sad because of the overdosing of the drug. And then check the label when you select it, draw it, and have the doctor check it before injection. Okay? So be sure to give contrast medium at the right time, especially if we are chasing time. For example, sa the urinary tract. For example, we are going to image the urinary tract, that is the IVP examination, or the IVU, that is intravenous urography, in which mag-injecta of contrast material kang pasyente, and then after 1 minute, expose. After 3 minutes, expose. After another na pud nga time, expose. Okay, so that's why you have to make sure you give the dosage, you give the contrast media at the right time, and you have to be careful also with the time that you give the contrast media to the patient, or you introduce a contrast media to the patient, in order for you to know what time will you be able to expose the patient. For example, 30 minutes pa ay na to i-expose si pasyente after na to introduce ang contrast material. So you have to take note of the time. Okay? So if ever you're handling tablet or powder, do not use your fingers. Okay, dili man na sila pulburon. Okay? So you have to use gloves, or as much as possible dapat naagid mo containers gyud ana. Okay? So if ever we will be handling powdered nga mga material, for example barium sulfate, as much as possible the night before, the day before the examination, dapat naka-prepare na gid na siya, dapat nakalahi na gitong exact amount that is necessary for the examination of the patient. And then record and chart the amount of medium or contrast medium given, the time at your initials. And then technologists give only oral and barium dyes, while the radiologist should administer the IV material. So this is also true there is ato ang hospital settings, no? For the barium nga mga, or the oral and barium dyes can be readily given by the radtech. Pero when we introduce contrast material through the venous system or the arterial system, dapat address atong setting, it's the radiologist or the emergency doctor that will introduce the contrast material. Okay? So sometimes the radtech is allowed nga mag-administer og IV material so long as naka-seminar na siya o kining IV therapist nga seminar, and also the radiologist would allow the rad tech. Okay, so for example, ikaw ang rad tech, naka-seminar na ka og as an IV therapist. Okay, so that means pwede ka, pero dapat ka mananghid sa imuhang radiologist. Okay, so dili pwede nga kanang kabalo na ka nya ikaw na lang gidayon tanan. So you really have to ask the radiologist, or you have to inform the radiologist on what you are going to do. So next we have methods of administering contrast media or contrast material. So we have two types, the direct method and indirect method. For the direct method, this method allows us to introduce a contrast material directly into the organ or the structure of interest. For example, barium enema, retrograde pyelography, and cystography. Diba? In barium enema, the organ of or the structure of interest is the large intestine. So in order for us to use the direct method, diba, mo introduce the catheter towards the anus of the patient, towards the rectal niyang cavity, and then dito introduce ang contrast material. Again, the rectum, diba, is already part of the large intestine. So that is a direct method because the contrast material is directly introduced into the structure of interest. Kani, retrograde pyelography. Pyelography, that is related to the structures of the kidneys, that is the pelvis of the kidneys. So retrograde, that means mag-introduce tag catheter towards the urethra of the patient. Atong ipasulod sa urethra, pasok dito sa yahang urinary bladder, and then from the urinary bladder, musaka din ang catheter towards the ureter of the patient, either the left or the right. And then from the ureter, introduce na to, ipasulod pa yun na to ayo ang catheter towards the pelvis of or the pelvis of the kidneys of the patient. Okay, that is retrograde pyelography. And then cystography. So tanato atong catheter gikan dito sa urethra ni patient, atong gipasulod dito sa iyang urinary bladder. So pag abot dito sa urinary bladder, mag-introduce sa contrast material. That's basically cystography. That of course, x-rayhan po sad si patient. So next we have the indirect method. We have the oral and then parenteral. So oral method, that means the contrast media is taken by mouth. Parenteral is other than the alimentary canal. That is either parenteral, that means dili mo agi sa mouth ni patient, dili mo agi sa anal canal ni patient. That is parenteral. Diba? You have intramuscular, intravenous, intrathecal. That is not through the mouth, or that is not through the anus, or basically that is not through the alimentary canal of the patient. Okay. So parenteral the oral method when the contrast media is taken by mouth. Nganong indirect man siya nga oral method man. For example, atong target is the stomach. If the target is the stomach, ato ipakaon si pasyente, ato siyang ipainom og barium sulfate. Ang barium sulfate is introduced in the mouth, and then the organ of interest is the stomach. So it is an indirect. Kay dili man ang mouth atong gina-examine, it is the stomach. So indirect siya kay nagsugod sa mouth ang contrast material, pero ang target organ is the stomach. Okay? So parenteral, for example, mag-introduce sa contrast media through the muscles, that is intramuscular, intravenous, towards the veins, then intrathecal nga method, that is injection of contrast media to the meninges of the spinal cord or the spinal canal. Next, we have the physical states of contrast media. Number one, we have the oil, tablet, liquid, or powder. So these are the physical states of our contrast media. We can either use oil, an oil-based contrast material. It could be the oil-based na to mga contrast material. They are also they contain iodine. It's not barium. Tablet natay iodinated pod sad ana, and also the barium nga tablet nga contrast material. Liquid is for both the iodinated and then the barium sulfate. And then the powder dayon is for the barium sulfate. Wala tay powder nga iodinated contrast material. And then last is the gas. Wala na apil din, no? That's number 5. Gas niyang physical state. Okay, so methods of introducing sensitivity test. Okay, so number one, we can introduce the sensitivity test. These are actually the old mga methods. Scleral method, one drop of contrast medium is put into the sclera of the eye of the patient. So, itulo sa mata ni pasyente ang contrast material. Okay, so positive reaction is irritation and swelling. Pero of course, diba, ma-irritate o gayo ang mata ni pasyente ana. And then the number two, sublingual method. One drop of medium is deposited in the inferior base of the tongue. Positive reaction is formation of hives and swelling. Pero the sublingual method nga way of method of introducing sensitivity test, medyo dugay po sa ang reaction ni patient. Okay, so the 10 to 15 minutes nga waiting time is too short rapod sa sublingual method. And then the intradermal method, 1 cc of medium is injected at the base of this beneath the skin of the patient. Siya, pero naa sa muscles niya. And then ang pinaka the best and pinaka common gyud nga ginagamit karon is the intravenous method or introduction of the contrast material, katong 1 cc of contrast medium injected towards the venous system of the patient. Okay, positive reaction, nausea, vomiting, and then shock. Of course, that is the worst na gid, no, ang shock niyang reaction. That means, for example, the cardiac arrest niya or respiratory arrest. So that's it. Thank you.